Hello, everyone. Good morning, good afternoon, good evening, wherever this finds you. My name is Amadou Diallo. I work for the START network. I am based in Senegal. So welcome to all of you to this session on anticipation early action at scale. I don't see exactly how many people are in the call, but I know that we were expecting around 50 to 60 people. So I believe some have already started to join in. If you can just maybe introduce yourself quite briefly in the chat by putting your name, the organization you represent, and maybe your location. It would be really great to have a view of the people we have online with us. So it's really a great pleasure to have you with us today to start this START Network General Assembly. This year, exceptionally, it will be done online, virtually. And it will be really great to go through this session with all of you. So maybe we'll wait a few minutes, or Zofia, do you think we can start?
Let's give it one more minute and we can start.
Okay. We'll wait a little bit then. Thank you very much, and welcome to all of you. We have Harun Kash from Islamic Relief Worldwide, Lucille, Sarah. Hi, Cindy. Hi, Emily Rogers, based in the UK. Hi, Laura. We've become really digital people now. You know, COVID-19 have forced us in a way to adjust, and for the first time, we have to do this event online, but we are trying to do our best to really make it look like the more closer to you, and make sure that it's a great experience and moment of sharing. Hi, Eleanor. Hi, Jonathan. Hi, Chris. So we'll just wait a little bit more if you allow us. Okay, so we've just wait one more minute just to let a few more people join us, and then we'll be able to start. So I hope you enjoyed the first part of this event this morning with a presentation from our CEO, Christina Bennett, and a presentation from Sarah Barr on our meal work regarding anticipation. So it was really interesting sessions. And we have more to come after this session, and we hope you'll still be able to join us. So, Zofia, I think it's fine now. I think we can start. Okay, great. So, hi everyone, and it's a pleasure to be with you today. So I want to share with you how at the START network we were able to successfully lead an early action response to drought that was carried out while COVID-19 was dangerously progressing, enforcing drastic measures by government while exacerbating population's vulnerability in Senegal. Just to give you some background, so the REPLICA program was launched in 2016, and last year we purchased for the first time a drought insurance policy. And following a rainfall deficit, a payout of around 23.5 million US dollar was paid to the country, with 10.6 million US dollar paid to the START network and around 13 million US dollar to the government of Senegal. This was the first time that a sovereign risk finance tool was leveraged by a non-sovereign actor. It is also the largest ever funding allocation to civil society for early humanitarian action. This payout allowed us to assist around 270,000 people, with at least 50% of women and children in 7 regions in Senegal that you can see here in this map, with each of the START network members being the one that carried out the intervention in the different regions. The activities that were carried out were cash distributions, fortified flour distributions, and awareness raising activities. These activities were planned to start before the lean season, where households are the most vulnerable, and this assistance was supposed to bring them support to reduce the impact of drought and avoid negative coping strategies throughout the lean season. Later on, a fourth set of activities was initiated to adapt to COVID-19 propagation risk, and these were the 4 activities that we carried out. Now, regarding the structure of the program, the existence of standard operational procedures, pre-approved plans were key elements, as it allowed agencies to focus directly on the implementation, as most potential sources of conflicts were settled and key decisions were already agreed upon by all stakeholders. So you can see here the 2 key documents that we relied on. So there was an operational plan that had to be approved prior to the purchase of the policy, and upon confirmation of a payout trigger, each policy holder was required to submit a final implementation plan that would be endorsed at national level, and it had to be approved by the government. And there was a very clear identification of the most vulnerable communities, or the ones that would be the most likely to be impacted by the specific hazard that was addressed. This shows the importance for a robust coordination structure involving all stakeholders to be in place, because it allowed us more than a year ahead of the start of the intervention to know exactly what we would be doing and how we would do it in case there was a crisis. It was a very critical success factor, as each stakeholder on the government side or on the START network side knew their roles and responsibility. And this avoided any dissonance on any part, and a very clear communication protocol between key stakeholders. Now, if we move to implementation, this timeline can give you an idea of the key milestones. For the targeting of beneficiaries, we used the National Single Registry Database, where we extracted lists of vulnerable households, and these lists were confirmed or rejected by local village committees, with the participation of 50% of women and youth in those committees. This ensured that all members of the community were able to give their opinion and be heard throughout the process. And the existence of such a database in Senegal was very determinant because it allowed significant time and resources savings, because most vulnerable households were already identified through nationwide surveys conducted 2 to 3 years prior to this intervention, and with detailed information disaggregated per region, department, communes, districts, or villages. And if a community disagreed with the database information, additional surveys and consultations were conducted, and in both situations, the final list of beneficiaries was always submitted to the approval of the local committee. This resulted in minor complaints coming from communities as they were fully involved in design and implementation. And within 2 months, the targeting process was more or less completed, and teams were ready to start activities, distribution activities. For the people that suffered crop failure and livestock loss due to the rainfall deficit, we had now the impact of the COVID-19 that appeared in the middle of our programming. And the COVID-19 pandemic exacerbated the situation further because it exposed the populations we had targeted and caused them a serious impact to their livelihoods. So around March, just when we finished the targeting and we're about to start our response, the situation escalated quite rapidly in Senegal, and it resulted in travel restrictions, closure of markets, food prices increase, decreases of remittances, and it's threatened all the economic sectors and added to the vulnerability of the communities. We were able to quickly adapt our intervention, aware of the compounded effect by integrating COVID-19 related activities, and we were able to deliver the first distributions in April. And right now, as I speak, we have finalized the intervention as per the pre-agreed final implementation plan, and more than 270,000 people have been assisted in Senegal by Start Network member organizations, with more than 90% of supported households living in rural communities, their main source of income depending on livestock and agriculture. More than 50% of the beneficiaries were women and children. And this intervention, which was supposed to reduce the drought impacts, also greatly benefited communities as it tremendously reduced the impact of COVID-19 on local income loss due to lockdown measures. Now, coming back to our work with communities, early action at scale can only succeed with community inclusion and participation. And we had started discussions with communities a year before the anticipatory action begins, while we had no certainty that there would be a drought or there wouldn't be a drought. And this was, the first reason was to collect primary data and monitor risk perception at community level, to have a human perception and buy-in from communities. This helped us collect valuable inputs across 8 regions on what matters to them, and simulate a crisis calendar map to know to what extent they could cope with a drought. And if an external assistance was necessary, what would be the priority assistance they would need? And also identify the window of opportunity for an early action from their perspective. This allowed full participation, ownership, and recognition of program impact and value in terms of accountability to communities. And finally, I wanted to say that as we have all witnessed it, this past year has been a very unique year for our planet and to a great extent for humanitarian practitioners. It was a reminder of how fragile we are as human beings and how disasters can impact us in so many levels. If we look at all the effects of COVID-19, and also we can see that it was an opportunity for us to demonstrate our resilience and the resilience of our humanitarian system to be able to support vulnerable communities in the hardest times. I must admit to you that it was a very difficult decision to take in March to continue this early action. But when we looked at the situation, we knew that we couldn't go back and we had to intervene. We had to stay with those populations because they needed us the most at that moment. And we went for the right decision. And to that regard, except the intervention of the government in Senegal, the START Network Early Humanitarian Response was the largest early action program run in Senegal. And this greatly supported vulnerable communities to manage a difficult lean season, who would have been an unprecedented situation due to the COVID-19 impact. All stakeholders, including government officials, local authorities, local organizations, and partners, acknowledged the efficiency, the relevance, the value for money, and timeliness of this early humanitarian action, and the positive impact and outcomes on several levels to protect vulnerable communities while building capacity of local organizations and communities in engaging and supporting early warning, early action programs. This experience demonstrates that the START network has an incredible capacity to design, pilot, and execute anticipation at scale with high quality standards. And we are confident that with your support, we can mitigate the impact of compounded crises that demand a paradigm shift today more than ever. The REPLICA Senegal is run in partnership between the START network, the government of Senegal, and the African Risk Capacity, and is funded by the German Federal Ministry for Economic Cooperation and Development through the German Development Bank. The 6 START network members that are part of this program are Catholic Relief Services, Action Against Hunger, Oxfam, Plan International, World Vision, and Save the Children. And thanks to these implementing partners, we were able to deliver aid to about 270,000 people in Senegal. And we hope that we would be able to show that we can do more and serve more people and save more lives. Thank you very much for listening to this brief presentation. And if you have any questions, I would be happy to answer to them. You can ask questions through the chat or in comments. Thank you very much. So if you have any questions, we have 10 minutes left. If there is anything specific you wanted to know, or if it's regarding maybe the setup, the partnership with the government.
Okay, we've got a few questions.
Okay,
I can read them out for you.
Okay, sure.
This one is from Harun Kash from Islamic Relief Worldwide. Thank you, Amadou, for the presentation. Given the success of this program, what are the plans to scale up and or use this in other parts of the world?
Okay, thank you very much for this question. So for the future plans for us is to secure what we have done so far in Senegal. So we are still in partnership with the government, and we expect to be able to continue working with them and purchasing a policy in parallel. We are also looking at expanding our ARC Replica program and we are in discussions with other countries where we would be able to support governments. So a lot of countries are being reviewed right now. We don't know exactly, but we would be trying to see countries where the mechanism is exists already, and then we would be entering in contact with the governments and with the START network members to see to what extent we can implement it there. So we hope next year to be in at least 2 more countries part of Senegal. Thank you. So I see other questions in the chat. I don't know, Zofia, should I go or should I let you?
Yeah, you can
Tell
pick.
me to.
You can pick
Okay,
ones to
okay, sure.
answer. Go ahead.
Okay. So I see that another question from Chris asking how much did the insurance policy cost? So the insurance we purchased in Senegal was about 2.5 million euros, 2.5 million dollars, sorry. And but it depends, you know, because once the country has is preparing to purchase for the policy, there is a risk transfer parameter session where there is an assessment of the global risk of that country. For example, in Senegal, we could estimate that the risk to drought it costs maybe 10 million. And then that would be the maximum coverage the country can purchase. And then you can select if you go for an insurance where you purchase the maximum premium, meaning that you have an insurance, 100% insurance, or if you just purchase one part of the risk, so maybe 50% or 60%. And so usually, even with, for example, our vehicles, you know, we would not tend to take like 100% insurance cover. Some people will take a part insurance, things like that. At government level and regarding these disasters, often what is the difficulty is that governments do not have the resources to purchase 100% insurance, would be very costly. So they would tend to purchase an insurance that they can afford. And that's where it's important to have a partner like the START network, because we can come and complement the coverage of the government. So for example, in Senegal, the government had purchased a 40% seeding risk, and then we complemented with around 30%. So overall, the country was covered up to 70% against the drought risk. So for sure, if there was a disaster, mostly drought, then for sure the country would have received a payment. So that's a very good question. So so regarding who purchased the insurance, so the insurance was purchased. So the insurance it's a sovereign mechanism. So normally it's only the governments who should be purchasing this insurance. But then this initiative was developed to allow civil society organizations to be able to participate in this process and to leverage these innovative mechanisms. And so regarding that, we were able to purchase a policy alongside the governments. So they have an insurance contract and we have a separate insurance contract. But the two contracts, all the process regarding the preparation of those contracts is done together with the government. So we have the same parameters than the government, and we should not purchase more than the government, because we are more here to complement and not to substitute to the government role. And this is to help to support technically and financially the government and make sure that in sometimes the governments would be able to really budget themselves the resources that they need to purchase those insurances. But with waiting for that time, we are able to support them and then purchase an insurance and implement as well, because we have the capacity to do so. So I see another question regarding how did the government implementation and work with the communities go? So as I said, regarding the parameters, regarding the implementation too, there is a lot of coordination done with the government. So we had few meetings to discuss about the areas where we would be operating, and more or less the areas we operated were different. So the areas we were supposed to operate, the government was not supposed to operate there, but we had all the discussions, the elaboration of the tools, the monitoring and evaluation framework, the targeting methodology. So we have worked closely with the government to make sure that we have exactly the same approach, even regarding the amount of cash that was distributed. All this was discussed with the government to make sure that we have a harmonized approach throughout the country, and then we could have an intervention that from an external point of view would look similar, whether it's done by us or by the government. But there was some differences because they did not carry out the same activities than the ones we carried out. The government went more for food distribution, but our intervention had different activities. Like I mentioned before, we had cash distribution and fortified flour distribution for pregnant women and pregnant and lactating women and children between 6 and 59 months. But overall, we had been able to see that most of the populations that were targeted by the government as well received the assistance they were supposed to receive. So I see another question regarding the trigger of the release of the funds. So there is a software called the African Risk View that is managed by ARC, so the African Risk Capacity. And the software is a model, so it's a drought model, and it uses rainfall data to assess the number of people that are impacted, and then gradually throughout the raining season, the model would be estimating the rainfall and then the situation, and it would kind of look at the historical data and the number of people that were affected by drought. Maybe if 2006 was a drought year, and then we see that this year rainfall levels look like 2006, then we would look at, there would be a calculation to see how many people were food insecure in 2006, and we will sort of report it to the actual number of population we have now. And that would give an estimate of the number of people that are affected. And based on that, there would be a trigger regarding the number of the risk that we have insured. So if we insured for a very low seeding percentage, it means that, for example, if there are up to 300,000 people who are affected, the insurance will not trigger. It will trigger maybe from 350,000 people, and then at that moment, a payout will be notified to the policy holder, and then they would receive the funds to be able to carry out the activities and assist the populations. So I see another question. If you are planning to assess the impacts and related assistance, can you demonstrate that there has been a positive? Yes. So we have been conducting several evaluation pieces throughout this payout. So we've conducted an independent monitoring. Due to COVID-19, we used a call center, and we have a very good information of the beneficiaries with cell phones, and also we were able to talk to beneficiaries as soon as they received the assistance to know what was their appreciation of the assistance they received, if they had to walk long distances before receiving the cash, if the amount that they received was the one that was communicated to them, if there was any protection or safeguarding issues regarding the way that the operations were handled, and then also regarding the impacts on their livelihoods, on on their society. We had also conducted other pieces of evaluation regarding the markets to monitor how markets were functioning throughout this intervention. And we are coming up with a lot of reports that would be shared with all of you. And definitely we would be communicating on the positive impact, from the perspective of the populations. We are also conducting other evaluations regarding the stakeholder engagement and the participation of the different parts on the government part, and also the other stakeholders that were involved, to really see what they thought about this program and this assistance, and how we could improve it if we have to do it again. So regarding the funding, this program was funded by the Federal Ministry for Economic Cooperation and Development through the German Development Bank. So they are the ones that provided us with the funds to purchase the premium. Okay, I see another question. I'm trying to answer two other questions. There are quite a few questions. So were there any implication of the government, civil society payout being roughly equal, other than adding 30%? What benefits did civil society bring to complement the government? So I would say that it's true that we could have just give the money to the government and they could have increased their premium, but we also brought in our technical expertise, because when we joined in, the Senegal model was only looking at only one reference crop. So and it was a cash crop, groundnut, and we insisted that there is also a subsistence crop that is integrated in the model. So we advocated for millet to be integrated, and that was done because we thought that most populations because the cash crop is the one that is used mostly by the people who farm to make money, while the subsistence crop is the one that is more tied to food insecurity or food security. So that was something that we were able to bring in. Also, the perspective of the work we did on for community inclusion. The ARC program is a very, I would say, official high-level program on the government side, hosted by the Ministry of Home Affairs. So it's almost very rare to be able to see anybody from civil society or local organizations to be part of the discussions or decision-making process. We were able to bring in the voice of international organizations, but also we had 50% of the organizations involved in this response who were local organizations on the side of the INGOs. So each INGO had to work at least with one local partner. And also we had this work we conducted at community level to make sure that the populations were involved. For example, I spoke about it a little regarding the targeting process. There was this database from the government, which was a very efficient tool, but we insisted that in each village where there was supposed to be a final list of beneficiaries, there was a committee that was put in place. And we insisted that in the committee, we had 50% of women who would also be able to give their opinion regarding the beneficiaries that were selected, and say if they were okay that this person received the assistance, or if this woman was more likely to be the one in need and to receive this assistance. So I would say that we brought quite few innovative and good practices to the government, and we believe that our technical expertise and also our expertise as humanitarians was very useful to the government, and we expect to continue providing that and participating also in that.
Okay, I think we're out of time now.
Okay.
I'm pretty sorry. It's such an interesting discussion and interesting questions.
Yes, so I mean, I'm available, in the Axel event platform, and if you have any questions, feel free to ping me. And I think there is a functionality where you can ask for meetings, so I'm free, if you want to have a meeting and to know more about the program, and else you can also contact me by email, and we can discuss further. So it was really a pleasure to meet with all of you, and I encourage you to go back to the Axe 11 platform to follow the other sessions with my colleagues. We have a lot of interesting things to share in our work, and really thank you for your support, and we hope to work with you again next year. Thank you very much. Thank you, everyone. Thank you, Zofia, for supporting me in this. Have a nice day, everyone. Bye.
Thank you, everyone.